Welcome. My name is Dr. Gregory DeVore. I'm a specialist in fetal medicine. As you are aware, the detection of congenital heart defects is one of the most difficult tasks for the fetal cynologist. This is one of a series of case studies in which I will review the images from a fetus with congenital heart disease. The purpose of this media program is to present a real-world situation in which the diagnosis was made and the fetus was not at risk for congenital heart disease. In 2003 and 2004, the American Institute of Ultrasound and Medicine, the American College of Radiology, and the American College of Obstetricians and Gynecologists published identical documents detailing the components of the ultrasound examination of the fetus. These documents have become the standard by which the legal community uses to determine if a breach of care has occurred when a misdiagnosis is identified following birth. Although these documents contain a number of recommendations, let's focus on the examination of the fetal heart. This statement is listed under the section Fetal Anatomic Survey. Prior to the introduction of the current ultrasound recommendations for the antepartum evaluation of the fetus, the only recommendations regarding the fetal heart was that the four-chamber view should be examined. There was no mention of the outflow tracts of the fetal heart. Currently, however, the following is a statement regarding examination of the fetal heart. The basic cardiac examination includes a four-chamber view of the fetal heart. If technically feasible, an extended basic cardiac examination can also be attempted to evaluate both outflow tracts. If evaluation of the outflow tracts is not technically feasible, then the physician should document why the evaluation cannot be performed, and consideration should be given to reevaluating the heart at a later date, or the patient should be offered the option of being referred to a specialist to examine the fetal heart. This patient underwent a second trimester ultrasound examination at 22 weeks of gestation. Prior to the ultrasound study, the patient declined second trimester maternal serum screening to detect Down syndrome and other birth defects. This is a B-mode ultrasound examination obtained by directing the transducer in a transverse plane through the chest from the four-chamber view to the upper thorax. Examine the sweep and identify the abnormal fetal anatomy. After reviewing the clip, ask the question, what is wrong with the heart? The four-chamber view demonstrates the pericardial effusion along the right ventricular wall from the apex to the base of the ventricles. This is the left outflow tract. First notice the ventricular septal defect. As diastole begins, the aortic valve leaflets close. The valve leaflets close over the ventricular septum. This illustrates the aorta, which straddles the ventricular septum and is increased in size. This is the three-vessel view. This image is labeled as follows: the small main pulmonary artery, the large ascending aorta, the superior vena cava, and the thoracic aorta. Identify each of the pathological areas that have been mentioned. The final diagnosis was tetralogy of Fallot. The fetus had trisomy 21.